have to be 18 years old to buy cigarettes and 21 to gamble or buy alcohol, but minors living with a gender identity issue can undergo hormone therapy before becoming a legal adult.
Planned Parenthood is hoping to make life a little bit easier for the transgender community. They are now offering transgender hormone replacement therapy for those under the age of 18.
We decided that it was time for us to expand the care we were providing.
My experience with Planned Parenthood was not necessarily a good one. I'm not happy with it. I'm not happy that I was just given hormones. When I walked in, I mean, I hadn't ever, like, my family didn't even know. I took my hormone shot the same day that I came out.
Girls who take testosterone, or T, for as little as 2 months develop a deep masculine voice, squaring of the jawline and widening of the shoulders, and an enlargement of the clitoris, giving the appearance of a micropenis, all of which are not reversible.
If it wasn't just as easy as just walking in and signing a form for something that permanently changes your body for essentially the rest of your life in some aspects, I think, like, if it wouldn't have been so easy for me to just walk in, I don't think I probably would have transitioned if it just wasn't so easy just to willy-nilly on impulse just go and decide to take hormones.
A receding hairline is common with significant head hair loss, which is accompanied by facial and body hair growth that does not go away even if the testosterone injections are halted. Do you really think these teenagers were informed before they signed the consent form?
The doctor come in who discussed with me the different options of testosterone that I could choose to use, I guess. So she gave me the option of gel, patches, an intramuscular needle, or a different type of needle, which I forget the name of. I opted for the intramuscular injection. I kind of just wanted to talk about the HRT services offered at Planned Parenthood. I was like, hey, how many appointments am I gonna have to come down for? I live 3.5 hours away. I kind of just want a general ballpark of how many times I'm gonna have to make this trip. And he said to me, you'll get your script on the same day. When I actually went to my appointment, it was super easy. I went straight in, signed a couple of waivers for them.
Did they actually read the form or just sign it? Boys who inject wrong sex hormones experience stunted growth in height if they have not yet achieved their adult height and underdeveloped bone structure.
How to start hormones, whether that be testosterone or estrogen, without going to therapy. How does Planned Parenthood go about prescribing you T? So pretty much what happened at the first appointment was they took my blood work. They informed me, they gave me like a little paperwork to inform me of what exactly testosterone therapy is, how it can affect you. My doctor wants me to start at point 3. However, when I expressed to her that I didn't want to be aggressive, she took it down to point 2.
What did it say on that informed consent form?
I went through Planned Parenthood and basically they just ask you a bunch of sexual history questions, but that lasted about like 40-ish minutes, and then you can go pick up your prescription as well. Which they do it very weird. You can like pick up your prescription before getting your blood test, which is kind of yikes.
Listen closely. Does anyone mention the side effects of these hormones as listed on the informed consent form?
I just kind of wanted to go over the process of informed consent through Planned Parenthood. The appointment was really, really easy. First off, they give you a bunch of paperwork. One of them, right here, estrogen and testosterone self-injection guidelines. It basically just explains how to take the shots and all that stuff, how to prepare, how to inject, all that good stuff. So that's really awesome that they hand that to you. The other paperwork that they give you is like the informed consent portion. So it kind of talks about what the hormones are, what they do, the benefits, the risks, the side effects. My doctor was really, really awesome. She basically was just like ready to give me a prescription.
Common side effect of cross-sex hormones: no ability to orgasm.
What my process was to get on testosterone. I went to Planned Parenthood, so they have informed consent. So I didn't have to get a letter from a therapist. They will take your blood pressure, they will measure your height and weight, and then they will also ask you where you want your prescription to be sent to. She will also have you sign your informed consent paperwork. And then the doctor will come in. While you're talking with the doctor, they will have you pick what type of testosterone prescription you want, whether you want like a gel or shots or anything like that. And then if you pick a shot, they'll have you decide whether you want to do intramuscular or subcutaneous shot.
Common risk of cross-sex hormones. Reproductive organs waste away. Atrophy, causing significant pain.
My experience starting HRT at Planned Parenthood. So I did start HRT. It was honestly a pretty easy experience, and the lady was so nice. We want to find a place that has informed consent because I know that's a lot easier than having to find a therapist. Informed consent I just liked a lot better. It's just a lot more direct, and yeah, I don't want to deal with like a gatekeeping therapist. I would definitely recommend that you go there because it was super easy.
Common risk of cross-sex hormone. Reproductive organs must be surgically removed, causing permanent sterility. Common risk of cross-sex hormones. If atrophied reproductive organs are left inside the body, they could be life-threatening.
We're going to open up our transgender hormone replacement services to patients who are under 18.
Dr. Susie Prabhakaran says they are excited to help patients become their authentic selves.
So we know that there's a need out there, and so we wanted to be able to provide that service.
Did you make any bad decisions as a teenager? What consequences did you face because of your bad decisions? Did they make you permanently lose your hair? Did they make you lose the ability to orgasm? Did they make you sterile?